I normally don't even really care about these politics and what the governor's gonna say, but with all this craziness going down, this is basically what I've come to realize is Colorado is they're kind of leading the way in a lot of areas in how this thing's playing out across the country, at least in our own little way. And so, whether or not you live in Colorado or not, you're probably going to hear some sort of speech from your very own governor in some way. Now, our governor is, I have a lot of mean and cruel and not so good jokes about him that I would love to say, but I'm going to refrain. um, he's just funny. He's just a funny guy. He's just a funny guy when it comes to how we've seen him interact during this whole I don't know COVID matter across the country. Um, he went he kind of straight up lied on national television when he went to Washington because he was like, "Oh yeah, we have our restaurants open and stuff." And in the middle of this, none of our restaurants were freaking open, you know. And so like people in Colorado are like, "You lying sack of crap." But he's supposed to give an update, and I don't watch all his updates. I don't even, yeah, I don't watch. I probably watched two of his updates, but I figured today might be a good update because we're heading into the weekend. The whole mask regulation has been put into place. Nobody gives a crap where or when you wear a mask. Doctors are coming out and saying now, listen, if you don't have a runny nose, a cough, a fever, it's not even good for you to wear a mask. Like for health reasons, it's not good. And so until like I don't know. I don't know when people will wake up. I don't know when they're going to wake up to it, but nevertheless, I'll help spread Governor Jared Polis's propaganda on Dad with a Phone for a little bit, and we'll watch his live. I'll make some funny commentary, and we'll go from there. We'll see. Who knows if he's even going to go live? I thought he was going to be live by now, but that would be a negatory at this time. He is not live just yet. So we'll see. Who knows? He works on his own schedule, I guess. I guess he's supposed to go live at he was supposed to go live at 12:30, but we ain't seen he ain't there yet. Governor moves on his own time. He had to get his mask, you know. So I figure we'll fake Polas. Orlando's getting worse. Everybody's getting worse. That's the narrative. That's the narrative that they're selling people is that it's getting worse. It's getting worse. Y'all aren't listening to us. That's not even true. As warmer temps happen, the virus is dying. That's how the virus dies. Don't put a freaking mask on. If you're asymptomatic, means you don't have any symptoms. You don't have a fever. You don't have a runny nose. You don't have this thing's got to take it's got to run its course. This man-made virus that was fabricated in the Wuhan lab needs to take its course. It needs to go. It needs to do it. It needs to run its course. And this way, the human race can continue to do what we have done with every virus that has ever touched the face of the planet. We have beat it. We are still here today, not because of vaccines, not because of man made science, not because of big pharmaceutical. We are here because the human race is a very durable thing. Just try to burn a human body. This is something that I have learned through this true crime world, how durable the human body is. We are built to last until we aren't, until we start dying. And so don't fear death. It's only the beginning. If you don't believe me, just wait till you're dead. And then when you die and get to the other side, you're going to be like, oh shit, this dad with the phone thing, he was on to something. This is just the start. Come on, Governor Polis. Where are you at? Bars now, yeah, the bars are closing at 10 p.m. because the coronavirus is much like the boogeyman. The boogeyman comes out at night. The coronavirus spreads at night. It's the boogeyman. If you haven't figured that out, it's because you don't understand that even as a child, when they tell you the stories of the boogeyman, they're actually trying to make you be scared of things like the coronavirus. That there are these little boogie things that run around at night and they're going to get you. We got to close the bars at 10 p.m. Got to stop that alcohol. I don't mind that you stop alcohol flow at 10 p.m. Just don't do it don't do it on the backbone that's going to help stop the curve. We got to stop the curve, kids. Stop the curve of the virus. The stuff that people have bought through this whole coronavirus whatever is crazy. The only reason we're not live with the governor right now is because Polis is busy sucking. No, I wanted to say a bad joke. Oh, I wanted to say he's busy getting some. No. Governor Jared Polis, the first openly gay governor. This is like the first open gay governor. He has a husband, okay? He might even be our first openly gay president one day. I think they need to stop making alcohol. Make hand sanitizer instead. We might be getting them. We might be getting them. Might be coming on. Come on, Governor, where you at? Dad with a phone has got a room full of folks waiting to see your address. We are right here waiting for you, buddy. Well, if you didn't know, now you know. Governor Polis likes the D. That's what they say. He likes the dad with a phone. I'm gonna kill myself. I'm sorry. Hope your kids are not listening. Kids, if you're listening, turn it off. Hey, Woodland Park PD, coming through town. Coming in hot. You got the back window open. What you doing over there? I should have put my traffic camera on while we stop. Dude, if you saw before and after pictures of the Capitol building, you would be up in arms. They're just letting that happen, right? He's called off. He's just allowing Tent City to go up, right? Y'all should not be making jokes. We should not be making jokes about the governor's sexual orientation. They are gonna slaughter me online. I'm gonna be slaughtered online. They're gonna decapitate me. Did you hear what Dad with the phone said about the governor? He likes the dad with the phone. Tracy, why can't I see your messages? Are you like hiding them from me? I can see that you message, but they're just blank. I don't understand. Dad with the phone don't have no sense of humor. This whole world is a joke right now. What are you talking about? You haven't been watching long enough if you didn't know I had a good sense of humor. You can say whatever you want. You're a crime guy. Every bad experience I've ever had has started out with alcohol. Listen, you're not going to get me to disagree with you there. Alcohol is like, it's part of the devil's juice. You know what I'm saying? But there are some times when alcohol is actually biblical. If you're a biblical person, one of my favorite scriptures is Proverbs 31:6. Go look that up in your bibbidi Bible. And then when you look it up in the Bible, you just know we are going to have a Bible study group over here, and we are going to study Proverbs 31:6. Oh, I like this. What's up? Australia's in the house. Australia, I gave y'all a shout out today with an anonymous video. Somebody from Australia sent me an anonymous video talking about what's happening in Australia. Anonymous wanted to let you know. The world is, you know what the world is? The world is such a big joke right now. Nobody even wants to talk about the joke that the world is. For real. People bitch, but they still come and watch. They addicted. They be like, Dad's a dick. Dad's addicting. I mean, no more dick jokes when Governor Polis is coming on. I can't be talking about the D. Oh, I'm talking about Richard, by the way. Richard Jarris Polis. If you didn't know, Richard has nicknames. wait. No. Please scroll scripture here on the screen like plunder. Absolutely. You're absolutely right. Let's go get Proverbs 31:6 and scroll it on the screen. Let's see. There it is. I work in the true crime world, okay? And in the true crime world, there's a lot of times that you have a heavy heart because you're talking about people who have died, and so sometimes you need a strong drink. So this is Proverbs 31:6. Give strong drink unto him is ready to perish, and wine unto those be of heavy hearts. So if you're of heavy heart, you got something tough going on in your life, pour a glass of whiskey. If someone's about to perish around you and you just need to mourn with them, pour a glass of whiskey. That's just biblical. So when I say we're having a Proverbs 31:6, that's code word for pour your glass of wine. I'm just teasing. I don't know why we're talking about wine anyway, or alcohol, by any stretch of the imagination. Oh, we're talking about alcohol because apparently in Colorado, after 10 p.m., COVID spreads with alcohol. Are you saying that physical contact between people happens after 10 p.m. and a couple of glasses of wine? Come on, Governor. I could have told you that. I could have told you that social distancing after 10 p.m. and a couple of beers, well, it kind of just goes away. I bid to tell you that if we continue with this social distancing and mask nonsense, people are going to die of lack of affection. They are going to die alone. So at 10 p.m., grab your beer, grab your honey, give her a little kiss, a big hug, and throw social distancing out the wall. Since they closed the bar, just go home and get laid. Jeez, he just said that on Dad with the phone. Holly said, I started watching Dad with the phone when COVID first started, and I'll be watching Dad with the phone when the world ends. Speaking of which, Chad Daybell, today is July 23rd, and Dad with the phone is live and well. The question is, are you still in jail or did you get raptured? Can somebody confirm that Chad Daybell is still in jail and has not been raptured? Because if he got raptured and Dad with the phone got left, I'm going to dig my way to hell. He just said that on Dad with the phone. If Chad Daybell got raptured last night out of jail, I'm going to be upset. Me and the big man are going to have a talk. Didn't you hear? You have to wear a mask when you're getting laid. Oh, God, I have a bad joke right now. I got 3 kids. I should probably have about 30. He ghosted out of jail through the portal. Through the portal. Whoosh, whoosh. Out of jail through the portal. Chad Daybell has gone AWOL. He escaped. Can you imagine if the headline read this morning, Chad Daybell disappears in the middle of the night? Can you imagine the world as we know it? People wouldn't believe us if Chad Daybell just vanished out of jail last night and the headline read, Chad, the prophetic Daybell, vanishes out of jail like Paul when the walls fell. Y'all know that the whole jail, like that's not even that's biblical too, right? So they put this dude in jail. They put this dude in jail in the ancient writings. He prayed to God and the walls of the jail shook until they fell. And he walked out of jail. So when Chad Daybell went to jail, when he was arrested, I was like, "Oh my God, is this prophetic or what, dude? If on July 22nd, Chad Daybell vanishes from the jail, this will literally be like scriptures out of the Holy Bible." But that didn't happen. Chad Daybell, I think, is still in jail. Governor, you're late, bro. Where the heck are you? I was trying to broadcast the governor's live, but I guess he decided he is too good to show up because he is fashionably 27 minutes or 25 minutes late. The governor's got me sitting here talking about Chad Daybell and Lori Daybell vanishing out of the face of the planet. And you're crazy today. Absolutely. It's a crazy day. It is a crazy, crazy day in Colorado. Life is good, though. I hope your life is as good as mine. I have a pretty awesome life. You know what's on the docket today? I've got a dirt bike ride with my son. My middle child is out birthday shopping with her mom. And then I am planning for a 2-day, 3-day fishing trip over the weekend. Tell me again, COVID-19. Stick around till November, baby. COVID, I need you to be here at least till November 5th. After November 5th, if you want to just hold out through the winter, through the flu season, you just hold out through the flu season, COVID, because my fishing skills are going to a new level. I might be fishing for a living because there are some content collectors out there that are really loving my fishing stuff. And so who knows? This COVID-19 might have made me a dog trainer. By the way, Muffins, I'm gonna have to show y'all what Muffins can do. Muffins is freaking smart. I might end up being a dog trainer and a professional fisherman by the time COVID-19 is gone. Can you imagine that? I would be so happy. Oh, governor's up.
On where we are today with coronavirus here in Colorado. Today, so far, the numbers are 616 new cases. We have 247 people hospitalized, and we're at 1,645 deaths due to COVID in our state. And always remember, behind each death is a real person, a father, mother, a brother, a sister, a friend, and we mourn the 1,645 Coloradans who have lost their lives to this pandemic. I want to thank all of you for joining us today. We're going to talk about testing and tracing and our work here in Colorado. 2 weeks ago, the average test turnaround time for people who were tested in our state was 1 to 2 days. Over the last few days and weeks, we've heard horrific stories of it taking up to 10, even 12 days for people's results to come back due to the national testing backlog. That is unacceptable. It is not helpful at all to have the results that far away. It's too late to do contact tracing, and it's already spread. And that's why we as Colorado are going to be taking matters into our own hands and expanding our state lab capacity and bringing additional in-state private lab partners online. We can no longer rely on that national testing. What 2 or 3 weeks ago took 1 to 2 days now takes 9, 10, 11 days. It goes into a black hole. So we need to take charge here. We're resourceful, we're resilient, we're going to get it done. Colorado's ability to expand our testing infrastructure really will help alleviate strains on healthcare and give peace of mind to Coloradans and help reduce the spread of the deadly virus. In the absence of a clear national testing strategy, Colorado is working hard to secure our own testing supplies, extending our state lab capacity, bringing on board private partners, university partners, hospital partners, and others. Of course, we're not immune as a state to the issues that face our national supply chain and national labs, but we know that in Colorado we can do better. And while we would all be better off if there was a national testing strategy and effective management of supplies, that's not the world we live in. So instead, we really turn to our smart, hardworking, innovative folks in Colorado who are building and expanding the very best system that a state can provide on our own. Really, with these goals that we've been pursuing from the start, acquiring more personal protection equipment, masks, gloves, gowns, face shields, testing equipment. We're in a strong enough position with equipment that we're providing it to teachers and schools, a mask per week. We are expanding testing with prompt results, tracking and tracing. We can't rely on these national partners that other states are forced to rely on. So we are building and contracting for our own additional lab capacity in our state. And we also need to ensure hospitals and local public health can meet the needs when there's a surge to act quickly and boldly to contain a site-based or community outbreak before it becomes a statewide outbreak and a statewide setback to our health and to our economy. As we work towards reaching these goals, we're trying to make it as simple as we can for Coloradans to thrive and get through this in the safer at home and in our vast, great outdoors period that we're in. We're going to make it simple for you. Here's the 4 things you should be doing. We got it down to 4. Of course, stay safe at home whenever possible. Just when you don't need to go out, don't be out, don't be with others. I know it's hard, but we're all seeking to reduce our social interactions. Of course, for older Coloradans and those who are vulnerable, stay home whenever you can. Wearing a mask, it is the law in Colorado, but don't just wear it where it's a law. I mean, when you go into a store, you have to wear it, but certainly we encourage you to wear it when you're walking your dog on the street and you're passing others. Wear it in many different environments, and there's different communities that have different requirements in Colorado. But don't wait for your community to tell you that you need to be smart and protect yourself. Wear your mask, and then of course scaling up testing, and then what comes after testing. Testing itself doesn't cure anybody and doesn't stop it from spreading to anybody. It's what comes next after the testing. Quick results. Who have you been in contact with? They get warnings. They need to quarantine themselves. Some of them will develop COVID, some won't. But we want to nip that outbreak in the bud. Now for a testing update, I want to tell you exactly where we are. We're running over 10,000 tests a day. And in mid-April, we were new cases were about 500 a day, but we were only running about 2,000 tests per day. And across the country and in Colorado, everybody was missing critical resources like swabs to conduct reagent tests. Those tests are more oftenly known as the brain tickle test. I took one in front of you. Most of the testing now is less invasive. If you're going to some of those testing sites, there are still some of those used, but there's also just the surface swab, saliva, number of different techniques. There still are some of those brain tickle tests. They're not that difficult, but it's moving towards easier. But testing needs to be easy, free, and quick for any Coloradan with symptoms. We set a goal, as you know, back in April of 5,000 tests per day. Today, we're over 10,000 average for the last week. And I'm also pleased to announce that the state lab processed an all-time high of 3,803 tests a few days ago. And that day, we also hit our overall daily high. 12,413 tests that day were processed. And our average has been over 10,000 for the last week, over 3,000 a day for the state lab. And our state lab really represents great excellence in the public response. I want to thank Dr. Emily Travanti and her team at the state lab for this unprecedented scaling and growth. It's quite a feat to go from running 200 tests a day to over 3,000 tests a day. And that's just the beginning. Along with our private lab partners, we know we cannot count on these national lab partners that are now showing 9, 10, 11-day turnarounds, which is not acceptable. It's fine. We're going to take on more in Colorado. We're ready for it. We have the ability to do it. We have the resources to do it. And while it would have been nice to have a national coordinated strategy, we ain't going to wait for it. And as a reminder, when you get a test, the test itself doesn't cure anything. If you have coronavirus, you have coronavirus whether you get the test or not. So it's important that if you have any symptoms that you stay home and avoid infecting others, whether it winds up being coronavirus or something more mild. You want to avoid infecting others while you are waiting, and conduct yourself as if you are contagious with the virus. Please protect yourself, limit your interactions with loved ones, just self-quarantine for 4 or 5 days after the last symptom subsides, and then you can go out. Since this virus reached our state, we knew that in the absence of federal leadership, we needed to bulk up our state lab capacity. We have a great testing team that's building a diverse portfolio of testing supplies, because when one goes away, we have another. And there's been everything from interference and delays from customs service to supplies being bought by others who outbid us. But we value that diversity in the supply chain, and accomplishing that has been a great achievement of the team in Colorado. And we can never be fully inoculated against other places with outbreaks. So if you want to know what is the reason, it's not that LabCorp and Quest just decided we're going to take 10 days instead of 1 or 2 days to process. It's because they were deluged with tests from the hotspots, Arizona, Texas, Florida. They received tens of thousands of tests, and they slowed to a snail's pace, and they're no longer very useful to us. We hope they get their act together and they're useful to us again, but we have alternatives, and we're taking it into our own hands in the state to aggressively implement those alternatives because of the huge backlog of national testing. And this is our strategy. We're going to build our in-state capacity while partnering with the private sector. The state partnered with local public health and healthcare providers, including community health clinics, to support over 50 community testing sites across our across our state. Free, quick, easy sites. You can go to covid19.colorado.gov. You can find one of those 50 free, quick, easy testing sites near you. We are also aggressively working on the in-state lab partners. Children's Hospital, National Jewish, 800 tests per day. Biodesics, Unipath, 1,200 tests per day. And then critically, to be able to meet our in-state need, we have agreements in place with private labs like Mako Labs for 2,000 tests a day, Curative for 3,000 tests a day, and ATCG for 1,200 a day. That's going to be a big part of us processing thousands of more tests each day within a day or two, and cutting through that backlog that we have not been able to count on our national providers to do. So we're going to get it done ourselves. That's the Colorado way. We've teamed up with Korean manufacturers to secure critical testing supplies for Colorado. We've had great contracts and delivery, and product as specified performs from our South Korean manufacturers. We're very excited about that. It's a great relationship. It's worked out great for the state. And having that resiliency and redundancy in our supply chain is so important, because at any point, what we've learned in this is anything can be cut off or shut down. Like 2-3 weeks ago, we would have thought, everybody would have thought, oh, our national lab testing partners have built capacity and they're turning around results within 1 or 2 days. Well, boom, that changed. And now they're taking 9-10 days. And so our strategy and approach has changed. And we've been building these relationships over the last weeks to make sure that we can deliver prompt results for Coloradans who are tested. We know that our state is unique in developing these important relationships directly with suppliers at home, abroad, globally, in our state, out of our state, directly, has really been a big part of helping Colorado be in a better position than other states are that might rely wholly on our own federal government or might rely wholly on the national lab testing partners. That would reduce our ability to respond rapidly to this test. We've purchased 300,000 tests, 450,000 swab kits from international suppliers, expecting 300,000 more, 800 swab kits over the next 8 weeks, about 100,000 a week. Our strike team that works to protect our senior centers, our nursing homes, has widespread proactive asymptomatic testing that they're rapidly expanding for residents and staff, and we've been able to bring down that infection rate and that fatality number at the same time as we're allowing more visitation. We have the outside visitation, we have other protocols for inside when it's necessary, but we value that connectivity and the mental health and behavioral health that we know that some in-presence aspect is needed. So we've been able to reduce those death rates and infection rates and allow for more reasonably safe visitation at the same time. And we know that we have to continue to do that because it's very important for our loved ones. We have distributed testing kits to facilities across our state. The National Guard was deployed and they've completed 11,384 tests. National Guard has been key to our testing capacity for our most vulnerable, for our senior facilities, for outbreaks like the outbreak in Buena Vista. And we want to continue to make sure the federal government extends the National Guard. They're currently through August. We will need their efforts in this pandemic, and they've been a big part of saving lives and saving our economy, frankly, in Colorado. State's also contracted with Colorado State University. They're providing additional testing at our senior facilities and technical assistance. They've completed over 12,246 tests, and I think that partnership is old, active phase, 31 facilities. In total, 134,320 tests have been completed or delivered to long-term care facilities. So we are really working hard, doing our part. Let's get to some of the tracing piece, because while testing, it's nice to know if you have it. The benefit to our state, to our economy, is in the tracing work that then ensues. We are working to make additional resources available, over $75 million, to our local public health authorities, and the state has 115 full-time case investigators and tracers. And I'm glad that the Colorado Department of Public Health, the state piece for those that are done by the state, we've been able to reach out to 96% of positive cases within 48 hours, and 72% have been engaged and responded. Remember, and if you get contacted by a health official, please cooperate. We're trying to protect you from potential COVID contamination and your loved ones, and we are proud of that rate. And this will help us. This increased rate of tracing and tracking will help us keep the virus contained in Colorado. We've also have another 300,000 swabs that have purchased and delivered from within suppliers within U.S. borders, 500,000 kits by the end of September. Now, to cover all of our bases, we want to expand and diversify our testing capacity as much as possible. Our state lab has invoked authority from the FDA to cut through red tape and approve novel tests for use in Colorado. We are very excited about that. We're evaluating an innovative saliva test developed at University of Colorado, 45-minute turnaround, and we are validating that, and we are very excited and applaud the scientists at University of Colorado who developed that, and we have been able to bypass the federal government by getting the authority from the FDA to move forward once that is validated. Studies will be conducted. We're hopeful. Of course, until you validate it, you never know for sure whether a technology will work. But we have a lot of irons in the fire. That's one that's public because University of Colorado announced it. But we want to be on the forefront of introducing new, more efficient testing methods in Colorado. And University of Colorado has reiterated that it's Colorado first, that they will be meeting our needs before they talk about opportunities to supply these tests elsewhere in the country or the world. When we detect the virus early, we save lives, and individuals have the ability to make sure their loved ones are protected, and we can make sure to move forward rather than backward. Now, we know that about more than half, actually, of our coronavirus deaths have been among older Coloradans and people with disabilities. And to be clear, this virus can be deadly for people of all ages, but just over half have been among older Coloradans. And that's why we assembled the residential care strike team in late April. I want to thank Randy Kuykendall and Bonnie Silver for their great work in that area, reducing the spread of COVID-19. One of the reasons that while our infection rate is up, our death rate is up at a lower rate is because of the success in preventing more outbreaks at nursing homes and senior centers. It's hard work, it's hands-on work, it's taxing mentally and physically. We know it's hard on everybody, but it's really important work, and I want to thank those that are doing it. It's really important for anybody who's been in contact with somebody who's been affected to take swift action, isolate themselves. In June, I announced that the Corporation for National and Community Service is mobilizing 800 AmeriCorps and Senior Corps volunteers to support our response through contact tracing and work. To date, we have 423 that are onboarded and are up and going. In additional 300 NCCC members and 350 Visa Summer Associates and 100 Senior Corps volunteers are joining in the days ahead. A very important piece of that work. Now, in addition to testing, in addition to tracing, another way to keep people safe is protection against the virus. Now, I generally wear this mask was made by my aunt for me, so that's why I'm kind of styling today. But these are cloth masks, and that's what I generally wear day to day. But we know that KN95 respirators and surgical masks are even more effective. They're even more effective than a cloth mask. And frankly, the more we have, the better. In addition to the masks, face shields, gloves, disinfectant, thermometers, surgical gowns, face masks. We have been very involved with acquiring these and setting up a way where others can acquire those. And I want to thank Noel Ginsberg, the founder and chairman of Intertech Plastics and founder of CEO of CareerWise Colorado, who really helped establish a team that's dedicated to ensuring that Coloradans have access to personal protection equipment. EnergizeColorado.com to find more. I want to thank Andy Rugg, Jordan Monk, Gary Schlatter, and all the marketplace volunteers who've made this possible. So many Coloradans have just come out of the woodworks and said, I want to help in this pandemic. Thanks to Noel and Andy and Jordan and Gary, we have a robust marketplace for personal protection equipment that works, because we know that finding personal protection equipment is tough. It's not like you're a company that wants it, you just call a supplier and you order it. I hope that we're back there someday. It's tough, But this group made sure that through its partnerships with CSU and testing lab, they run stuff up there regularly to test. We get a shipment of KN95s. They run a random sampling up to CSU. They blow stuff at them. They measure them, and they're validated. And the ones that don't validate, we don't order. Everything's tested. Everything's verified, or we just downgrade and use for things that are less sensitive. So we have a great testing program, thanks to Colorado State University, to make sure everything we buy meets quality standards, good on price, good on quality, so the Colorado businesses and nonprofits and others get the protective equipment that they need to have access to it. So you can visit energizecolorado.com to learn more. And because of our success in acquiring personal protection equipment, we're supplying all K-12 schools in Colorado with 1 mask per week per teacher for the next 10 weeks. And, if we're continue to be successful in our supplies, we do hope to extend that. And we're working on the logistics and process around getting those out to the districts every week. We're also supplying private schools, Catholic schools, charter schools, boarding schools, all kinds of schools in Colorado. We want to make sure that teachers and on other student-facing positions like a school clerk and others, they will all be receiving medical grade masks. That can complement the effort of districts to use energizecolorado.com or to establish their own relationships to purchase even more high quality protective equipment for those who are in and around students every day. I also want to make sure people know that those shipments to schools and school districts and independent schools, they're going to start going out in mid-August, no matter what format that district is in. So some districts are in person, some are in hybrid, some might even delay a little bit, but they will all start getting those masks. And if they're not fully back yet, they can just stockpile those masks for when they do go back a couple weeks later. But we know that many districts are back in mid-August, and we want to make sure everybody has at least some level of medical grade protection. And frankly, as we can successfully acquire more PPE, we hope to be in an even better position to supply other frontline workers with additional personal protection equipment, while making sure that we have enough on hand for our medical facilities, of course, as the first goal of this is to make sure that we do not have shortages on the medical side. The fate of our state in both suppression and economic recovery is in your hands. We do what we can around here, but it really depends on you. Wearing a mask, staying safer at home, avoiding contact with others, staying 6 feet away, washing your hands, being smart. We said these things a number of times, but what matters is not what I say, it's not what I write, it's what we do, what we all do in our lives. And there'll come a day when we're back to normal and we all, hug one another and burn our masks in a big bonfire, but it's not today, it's not tomorrow, it's not next week, it's not next month. So we have to learn to live with this and prevent providing a social environment that gives the virus a chance to exponentially expand and overwhelm our healthcare system. And we've seen a 4-week increase now in cases. And as a result, there's a demand for more testing. The backlog on the national labs because of the hotspots has led us to take a far more active role in test processing. Public side, our state lab running 3 shifts a day. Dr. Emily Travanti and her team, they're working 24 hours a day. Not each person, obviously, people have to sleep, but they're running 3 different shifts, 3 different 8-hour shifts. So we're able to maximize the equipment usage there. Over 3,000 tests a day. And then the additional private partners we brought online because of the unreliability of the national testing partners. And to get testing right, we need more public-private partnerships, more public capacity. We can't count on our national partners. There is no national testing strategy. So we're going to lead by example in Colorado and be one of the states that gets it right. I want to thank our state lab workers for their work, fearlessly facing each challenge, being innovative, getting things done. And when we actively work to scale up our lab capacity, our testing, our tracing and support, our logistical support, I know that we can do our part to help you face the challenges that lie ahead. So continue to be safe, be vigilant. Let's stop this trend in Colorado. We hope that the increased mass usage and the decreased nighttime socialization, we hope that those 2 factors, we don't necessarily see the results in data yet, but we hope that will help reverse this. But the bigger factor is what we all choose to do, right? Not having 30 or 40 people in your home for a party, right? Have one other couple over, right? You can see people, but the parties are the dangerous environment, because it makes all the difference in the virus going from 1 people to 3 people and maybe being contained versus 1 people to 56 people, which happens, right? If you give the virus, it's highly contagious. And when you have a large party with lots of interactions and lots of people, it's not a question of if. It will, if one has it, and that's reasonably likely. You know, there one in, I think, what, 600 or 700 people in our state are contagious with it. So there's a decent chance that somebody at your event has it. That could be 56 people the next week. And of that 56, guaranteed, 4, 5, 6, 7 hospitalized, and quite possibly 1 or 2 not making it. Right? I mean, this is serious stuff. That's why we're treating this seriously. So we're in this together. Rural, urban, left, right, Republican, Democrat, Independent. It doesn't matter. It's a virus. We're going to beat it because Colorado is better than that, and we're going to get through this, and we're going to win. Thank you. We'll take some questions.
Governor,
yes.
First, happy opening day.
Yeah, we never thought it would be like this, did we?
Right. I know you don't like it when I go off topic, but I'm sorry. 3/4 of this governor's mansion is surrounded by tents. Kill cops, F the pigs. Veterans Park in downtown is atrocious. The state capitol is going under $1 million in repairs. What kind of message is it sending from the state to law-abiding citizens that this seemingly is tolerated by you and state government?
No, I have zero tolerance for unlawful behavior, and I hope that any perpetrators of unlawful behavior, whether it's defacing buildings or engaging in violence or crimes, they should be apprehended and they should be charged. And you know that it's up to the jurisdiction that they're in to do that. I know that Denver Police Department is working hard to try to make sure that they can hold those responsible accountable. I think they need to do even better. And we're also, of course, engaged in discussion about how we can better have authority with our state troopers to be able to have some jurisdiction within Denver. And we have worked with DA Beth McCann to be able to get the authority for our own officers of the peace. And keep in mind, we have a much smaller capability than a big city like Denver, because we can't stop patrolling the highways all over the state. That's mostly what we do, highway safety. But we really need that extra ability to be able to prevent damage to our they're not just our, it's not just a building. I mean, this is kind of it's a big part of our republic. It's who we are. It's our state capital. It's symbolic. It's important. And frankly, when it is desecrated, we all are desecrated, and democracy is desecrated. So we need to make sure that we protect all private property in Denver, and Denver Police Department is responsible and will continue to do that. But there is a particular responsibility to protect our republic itself and the symbols of that republic.
Still there to the average Colorado.
Well, if there's tents, I mean, yeah. Well, yes. So if that has any more to do with whether there's a camping ban in Denver, whether they allow it, whether they don't, all kinds of cities have different policies on tents. I thought Denver voters voted for the camping ban, but it seems like maybe they didn't. I don't follow Denver politics, but I mean, this is something that's up to voters. If cities want, they can have tents on their streets. If cities don't want, they don't. Oh, well, they are welcome to come onto our property and remove tents. We not only welcome, I would encourage and invite anybody. If there are anybody who is squatted on state property, we encourage anybody, law enforcement agency, of course, to come remove them. I've asked the mayor and the city council, and I really want the city council to act, and the mayor, but they've, I mean, obviously we've been asking them for weeks, but I think that if you're talking about Civic Plaza, much of that is city property. Some of it might be state property, but even if it's state property, it's subject to Denver law. So I believe that, again, I'm not an authority on Denver law, but I believe their voters voted to have a camping ban. It doesn't seem to me like that's being enforced right now. I do see people camping. And I believe, I'm no expert on municipal ordinances, but I believe that is illegal under Denver law. It certainly is, but that's very different than damage to property. I mean, I live in Boulder, and we've had issues with campers and squatters for years, and it's a nuanced issue, and it's dangerous when they're in the mountains because the forest fires, and they don't want them on Pearl Street. So I mean, but that is different than a crime. I mean, if you're going to stop a squatter, you just say please move, and they move. Somebody who commits a crime and causes estate damage, that is a chargeable offense. So I mean, they're two very different things. I don't want to conflate those. I mean, a tent, in a camp is something that is up to a city. They want it, they don't want it. But destroying property is against the law everywhere in Colorado. Yes.
Yeah. So, Governor, the restaurants and bars here in Colorado have filed a complaint and asked for a temporary restraining order on your last call order. They kind of feel like you're picking on them, saying that there are more outbreaks at different restaurants than at bars. How are you still going to move forward with this? Are you going to talk to them to try to talk this out, or what will your action be now?
Well, I agree that it's a terrible temporary rule. It's people should be able to drink and enjoy their friends and at all hours of the day and night. I don't think it should be cut off at 2 a.m. In the pandemic, though, it's less bad to say we have to stop at 10 than it would be to say, like other states have done, we have to stop in restaurant dining, we have to shut down parts of our economy, or others will die. So, during this entire pandemic, we're always faced between the less bad of multiple choices. So to me, it's a clear choice. Yes, it's less bad to have a last call at 10 than it would be to reduce dining capacity, shut down public events and youth sports, and risk school starting, and all of those things. The restaurant outbreaks. I think our restaurant policy has been quite successful. So yes, there's been outbreaks. There's going to be outbreaks in every type of environment. There's going to be outbreaks in factories and offices and restaurants. But when you look at them, we see generally that it's 2 people, it's 4 people, it's 1 person. If restaurants were not doing a great job maintaining these safety requirements, you would see a very different set of numbers. You'd see a restaurant outbreak with 20 people in the kitchen and staff, and 44 customers, and we're just not seeing that. It's really good. We're seeing it go from 1 to 2, 1 to 3. It's because the staff at restaurants is diligently wearing masks, protecting these protocols. The tables are 6 feet apart. I dined outside last night, and it was wonderful. It was only my second time out, and outside is good as well. So that's very different than the social behavior in a bar at midnight or 1 a.m, which is difficult to separate from the inherent value proposition of why people want to be out at midnight at a bar. I mean, yes, there might be people who go to a bar to drink alone, and they're going to have to drink at home alone. But most people go out to socialize, and that's a tough thing to give up for a short period of time. And I don't like that Coloradans. You can't be at bars and nightclubs. America hasn't figured this out, and I think to a great extent the world hasn't figured this out. We need to find the way that people can have fun in a safe way, and we've got to reverse the trajectory of this virus. And this, along with the mask order, are the 2 things that, with the data that we have, and again, we looked at the mobility data for bars, the information from tracking and tracing about where people were getting it in connections to private parties and to late night bars, and some of the national data, which is why we took that step. Jesse?
I wonder if you're worried with the decreased test capacity, if the situation is actually a lot worse in Colorado. You've talked a lot about how we're 5 or 6 days behind the data, given the way the testing works. It might be 15 or 20, given the fact that testing is so far behind in Colorado. And I also was curious, if you could talk about how soon you plan on getting some of these increased testing capacities back, and also what the cost might be to the state if there's any kind of extra burden since we're not using those national providers.
Yeah, really, they're rolling on starting immediately. So some of them like National Jewish already online. The 3 big private ones that I mentioned, and let me So Mako Labs, Curative, and ATCG, these are all rolling on in the next week or so. 2,000 a day, 3,000 a day, 1,200 a day. Generally, this is CARES Act money that we're using. So that was the purpose of the CARES Act money. The national lab partners also aren't free. And so the costs can be a little bit more per test, but they also can be comparable. So, I mean, they're not, and we negotiated, we reach a reasonable way to do this. But what we need from a health perspective is quick turnaround. I mean, frankly, even $1 is too much to spend on a test that takes 10 days to get back. I mean, it's almost worthless at that point. Maybe it's nice to know if you had it, but I mean, you're done. You're very likely, you're either in a hospital or you're better after 10 days. In most cases, right? Maybe a few, you're at the tail end, but you're usually at one of the two. By the way, the average time to hospitalization is about 7 to 8 days from when the first symptom occurs. So yeah, these are rapidly coming on board. We have the CARES Act money, and I've talked to Senator Gardner, Senator Bennett, our federal legislators about the next piece, and I think that both the Republicans and Democrats agree that there will be a testing piece for additional support in this next round. But by what I mean by saying that is it was in the House passed Democratic version, and it was in the Republican version unveiled by Senator McConnell yesterday, a testing piece. I think it was $16 billion in one. I can't remember what it was in the other. But the only test that's worth a penny is the test that you get back within a few days. And so no matter how much less these tests take that take 10 or 12 days, they're frankly worthless.
Can you talk more about that? I think you said CU rapid testing.
Yeah.
Can you talk more about?
Yeah,
that?
they made an announcement, which is why I'm talking about it, because we always, it's theirs to announce, not ours. What we're announcing is that we have got the authority from the FDA to validate it and use it in our state. This is a way to bypass that normal sort of red tape and many years of work that would go into validating it. Once we can validate it, we can use it in state. Doesn't mean they can use it out of state, sell it out of state. We can use it in state. We will know its accuracy rate, because what we're doing is the protocols of the test are, there'll be a number of Coloradans, several thousand in the next few days, that will take two tests. It's very easy because it's saliva. So saliva and the normal one, right? And then we will compare and validate whether the CU developed saliva test has the same or similar accuracy to the other one. Frankly, even if it's a little less, it will still be deployed. We use, for instance, the Abbott quick turnaround. Those are the so-called 15-minute tests. They're much less accurate, unfortunately, but they still have a use case because it's 15 minutes. So even if you get some folks who, for instance, work in a senior facility, and even if it's 70, 80% accurate instead of 95, there's still a use case for it. So we will see the sensitivity of this test, and then we will work with CU to deploy this in Colorado if it's confirmed to have a accuracy rate which is useful as a way of monitoring the spread of the virus. Yes?
Governor, can you talk a little bit about schools and testing? Is there a specific threshold that you would like to see in order for schools to be open?
So the protocol for school-based outbreaks is being developed, but it won't be too different than our general outbreak protocols, which mean there's a surge of testing, right? So when a meat plant has an outbreak, a corrections facility has an outbreak, Buena Vista, I think we had 1,200 tests that we did there over a couple-day period. If a school has an outbreak, there would be a testing surge for that school, where all of the cohort would be tested. And depending on the extent of the outbreak, in some cases, everybody at the school will be tested. So just as we would deal with any other type of institution in society, residential or not, testing is a part of that outbreak strategy. So did that answer your question?
I just wonder if there's a certain number. I mean, obviously, you've got a lot of apprehension from parents.
Well, I hope there's no outbreaks, and therefore there's no testing, but that's not realistic. Just as there's outbreaks in restaurants, there's outbreaks in factories, there will be site-based outbreaks at schools, like there is in any type of building or office or work. And our response will be, and the reason the cohorting is so important is when a person has it at a school, hopefully the whole school doesn't need to shut down, but just those who were exposed to that person, meaning that cohort. Miss McGillicuddy's 4th grade class stays home for 2 weeks, right? Goes online. All are tested. And then, of course, if it becomes a site-wide outbreak, it's possible that entire school would need to convert to an online format if, 8 different people in 4 different grades have it. But the goal is, just like it is with an office, you want to isolate it to a cohort. And testing plays a very important role in that, in determining and giving you the surveillance about whether you've succeeded in limiting the spread to a cohort of kids or whether it has become a site-wide problem.
Do we have enough tests, or do you anticipate we'll have enough tests to be able to detect?
Yeah, I mean, that's what this is about. So like we had the Buena Vista corrections outbreak and we surged 1,200 tests there, right? In a, I don't know, 2-day period or something, and everybody got tested. So yes, there will be the ability in working with school districts and county health, and the county health authorities know this is one of their priorities, that they need to be on the ball and quick in responding to any kind of outbreak. These are restaurant outbreaks. These are factory outbreaks. These are office outbreaks. These are school outbreaks. Whatever type of environment there's an outbreak in, testing is a big part of that response. And I don't have it in front of me, but I'm happy to get you. Because I don't have it here. Of the 12,000 tests, I think our team can probably identify. It might not be the exact number, but we can tell you how many of those are outbreak and facility related, right? It could be 2,000, it could be 1,000. Remember, some are just individuals who think they might have it. They go to Pepsi Center, they go to a community testing site. Others are folks where it's at a site like Buena Vista. So that 1,200 will have shown up in the last day or two. I don't know where it's allocated. Others are also site-based. So some percentage of that total are site-specific, outbreak-specific testing. The rest is community testing. I don't want to commit my team, but I know we have at least estimates. We'll get that to you, kind of which is which approximately on it, and it changes day to day, obviously. Telephone. We have a telephone? Okay, go ahead. Oh, technical difficulties. See if they want to text you 1 or 2 from the telephone. I always feel bad about our telephone friends. Yeah.
So, Governor, some of the restaurants and bars that I've spoken to the past couple of days are asking if you would consider perhaps moving that last call to midnight for restaurants. And so
yeah, that's where I hope to be. That would be the next phase. We hope that if this works for a couple weeks, that it goes to midnight. By the way, nobody has to close. I mean, restaurants, many of them are open till 10 or 11 anyway. They can certainly be open till midnight. It's just the last call for the beverage service, right? So if people are sitting down to eat at 9:30, and some Coloradans do, it's a late dinner, but they do that in there's plenty of Coloradans that like to have dinner at 9:30. You go out, if your restaurant's open at 9:30, most of my favorite are closing, but you go out at 9:30, you just order, you order the drink part at 9:30, but yeah, you can have your food at 10:30 or 11. Nobody cares. If your restaurant's open, stay as long as you like. It's not a perfect proxy, but the goal of what this policy is, it's preventing the social behavior that where inhibitions are dropped associated with alcohol in a public environment. It's not a statement against alcohol. My personal feelings about alcohol, just like marijuana, it's your choice. You can do it, and you can drink in your home. And of course, you can drink, but it's the natural social environment that exists in bars and nightclubs that is simply inconsistent with the way that we need to live during this pandemic. And again, with positive news, with these numbers hopefully going the right way, yes, that would likely be the next step in a few weeks, would be to go to midnight. Yes, we have we're not going. I apologize to our friends on the phone. We're going to get. I'm just going to go through a few because they had technical difficulties today. Faith Miller said, "Oh, and I think David Clough also. They talk about Representative Dave Williams and a letter. What will be your action if the president chooses to expand Operation Legend into Colorado?" A lot of questions in that category. The state of Colorado has not requested federal troops, right? A Coloradan has. I'm sure other Coloradans have written different people and asked for it too. But when this is an official channel, the state of Colorado, I'm the commander in chief. I've activated the Colorado National Guard. They're doing great work. They're helping with testing. They're helping with support. The state of Colorado has not requested troops. for any purpose. If we need them, I won't hesitate to call upon President Trump, to call upon federal support. But the National Guard is doing great work, and we have additional capacity on the National Guard side, by the way. I mean, if I needed more support around testing, around tracing, around preventing violence, I would turn to the National Guard resources to do that before I would call for troops that are not under my command. That would be a last step. Vinny from Bloomberg says, we're in a pandemic. Is the White House making a power grab, sending federal police units into cities, risking a constitutional crisis, stepping too close to the line? Well, Vinny, yeah, look, in the areas that they have sent troops, it obviously was like putting oil on a flame. I mean, it clearly makes the situation worse, escalates it. The way that we would approach anything in Colorado would be to work to de-escalate rather than escalate. We want order rather than disorder. We want people to respect the law. We don't want people to be chaotic and violate the law and fight with federal troops. So that is kind of what guides our actions. So I think that's all I have. And I want to thank all of you again. It's going to be our behavior that gets us through this. It's going to be the mask wearing, the staying home, the staying 6 feet from others. We will be seeing the data from the mask wearing probably in the next week to two. I think Jesse asked a very good question. Because of the increased time in the testing, which we're rapidly fixing, but at least where we are now, there is that additional lag in data, right? Now, some tests, we still are turning around tests in 2 or 3 days in our state, by the way. I mean, the state lab is at 3 to 4 days and hopes to be back down to 2 to 3 days. But the bulk of the number of those tests from last week were shipped to national labs. And that's where you're talking 10 days, 11 days, 9 days. Sam on my team got tested. And Sam, what was it, 10 days, 11 days, 14 days, right? I mean, that's ridiculous. It's actually, and he was very responsible. He actually quarantined for that. But by the time he gets it back, the quarantine period's over anyway. So it was meaningless. That is unacceptable. And it shows the failure of the national testing lack of planning. It could have, would have, should have, right? So we're not going to fix that. We're gonna go around it and get it done. We're scrappy, we're smart, we're entrepreneurial. We're gonna get this done for the people of Colorado. Thank you all. Thank you to my Aunt Janice for this stylish mask, and thank you to all of us for joining us. And let's stay safe.
Put your freaking mask on. Whatever. This dude is a joke, man. I'm not even gonna try to. I need to straighten my mask though. I'm gonna wear something so freaking brilliant here. There we go. Put your mask on. It's not gonna save you. I'm not gonna wear a mask anywhere ever at all. The doctor says don't wear a mask. The governor says wear a mask. So you do whatever you want to do. Hey, I want to tell you what the Canadian CDC are putting out. Okay, now this is kind of risque. So don't get upset at me if you're just joining. You can tune out right now. But the CDC from the Canadian CD suggests the use of EG glory holes that allow for blank contact but prevent close face-to-face contact. So I'm just telling you, this is the CDC according to TMZ, and that's the Canadian CDC. So there's your Canadian CDC guidelines. There you go. This is all about, hey, the alcohol question was a good question. Why alcohol? Well, all I'm saying is stop serving it at 10 o'clock, but you can stay open till midnight, 2 o'clock. We just saying last call, quote unquote, last call is at 10 p.m., just 10 p.m. it. And so, we don't want the risque, the social distancing thing that happens when people drink alcohol. I don't got nothing against alcohol. Nothing against alcohol. Oh my God, guys. If y'all watch this, I don't know what to tell you. I mean, I don't know what to do for you. Doctors are saying don't wear a mask. It's not good for you unless you have a runny nose, a cough, a fever. If you don't have symptoms, don't wear a mask. Limit the time you wear a mask until you absolutely have to. This is the mask that I wear when I have to put on a mask. I'll wear this mask fishing. Sometimes the bugs are so bad, I have to put that mask on so I'm not eating the bugs. And so that's my mask that I keep, And if I got to go into the bank, I put that mask on. And, shout out to my boys in Florida who sent me this. Dude, this mask I've had for a minute. You can see how worn out it is, how faded it is. I've been wearing this mask for a minute, man. I always wear a mask when I'm fishing because the freaking bugs get up in your mouth and stuff. So during the hatch, you always got to have a mask on. So anyway. There you go. I don't do a lot of politics. This is the very first time I've actually watched a whole governor's address. That's not even a lie. I promise you. That's the very first time that I have literally gone through and watched the entire address brought to you by the governor. You learned a lot about the governor today, and what are you going to do? That's how life is here in Colorado. They're going to do what they're going to do so that they can control what you're going to do. So, no drinking alcohol after 10 p.m. at a bar. Go to your house. Go to your house, kids. Get a little hanky-panky on in the glory hole, according to the CDC from Canada. And, stay away from that face-to-face contact. Oh, my gosh. Can I go away now? Thanks. I'll see you guys later. We're going dirt biking. I'm out of here.